And here we go. Okay, we'll share the screen. Awesome. Okay, if there's any issues hearing us, or if ever we're speaking and you can't see Amira or I, just put it in the chat and I'll try to keep an eye on that. So Amira and I are here today to discuss mindfulness for your fertility journey. A bit about me for anyone that I haven't met in person. My name is Dr. Ashlyn Lanigan. I'm a naturopathic doctor and I've been practicing for over 8 years now. I've worked with hundreds of women to support them getting pregnant, to flourish throughout their pregnancies, and to return to their former glory, and then some as women. Or as mothers and women. I know many of you have had your fertility plans put on hold because of the closure of fertility clinics. I know others are trying to conceive, but the added stress right now is really taking a toll. So we truly believe that developing a mindfulness practice to cope with these uncertain times is more important than ever.
Yeah, so important.
I'll let Amira introduce herself.
Yeah, so my name is Amira, and I'm so glad to be a part of this. I can relate to some of you as I experienced my own fertility journey 11 years ago. So my husband and I, we went through secondary infertility, and so we conceived our daughter quite effortlessly. And when she was 1, we were trying for number 2, and that wasn't so effortlessly. That didn't happen so easily. And we, after a few months, I went to my family doctor, who eventually referred me to the fertility clinic. And they were quite hopeful at first. And they, started to do all the normal tests. And we did a few IUIs. And then they discovered we had a number of different factors, but it was primarily male factor infertility. And they told us that if we wanted to expand our family, IVF would be our best option. So 11 years ago, we went through IVF and we were successful, and we conceived a set of twins. And I'm so grateful, and my story has a very happy ending, but I can't forget the emotional impact and the pain I went through during the journey, of the point of it not happening when I wanted it to happen, and then having to go through fertility treatment. So I always remember when I was going through it that if I get through this, I'm going to focus my career on helping other women get through it, because I know how devastating it can be when we want something so badly and it's not happening for us. So when the twins turned 2, I was always a therapist. I have my master's in social work as well as my bachelor's. And so when the twins turned 2, I started running a support group. It was very grassroots. It was from my parents' condominium amenity room. And we had 7 women, and I could just see how fabulous it was when the women got together and shared their stories and shared their journey, and could see the suffering in each other and can connect and talk about their shared experience. And I also provided techniques such as mindfulness, as well as other ones that could help them channel some of the anxiety and help them to cope better. So from there, I started to run the group at one of the local hospitals in Toronto, and it just kind of flourished, so to speak. And I started to run a program online, which is the Mindfulness Fertility series. And so I'm really, really passionate about this area of work and just helping you move through this journey with greater ease. I know it's easier for me to say now that I'm on the other side. I don't remember there being a lot of support while I was going through it. And I know it doesn't need to be so difficult. We can actually try to use it as an opportunity. So that's a little bit about me. Since I've been working in this area, I've gone on to do some other training, such as my hypnotherapy certification, and I've got my level 1 in my Reiki practitioner.
Amazing. Thanks so much for sharing, Amira. So nice to hear somebody's story and how they kind of ended up where they are. My purpose in life is to empower women. I really believe that when we have this proper support network, kind of like what Amira was talking about with her support group, we can achieve our dreams and we can really reach our goals. And so that's my goal in life, is I believe that women are amazing beings and can really do anything. And so that is my why. So that's our whys. This is my daughter Frankie, who's my small miracle, my first baby, and I just, if I do nothing else as a mother, I hope that I can truly empower her to do whatever it is that brings her joy in the world. Okay, so for about the next 30 minutes, what we're going to do is we're going to review the research on mindfulness and fertility. We're going to discuss what mindfulness is and how you can implement it into your daily life. Amira is going to lead us through a mindfulness exercise, and then I'll make sure we have time at the end to answer any of your questions. I put up an Instagram poll this week, and I know a bunch of you sent me some awesome questions, which is so great. So I will definitely get to all of those. I know some of them were mindfulness based and some of them were more just fertility based. So I'll definitely answer all the questions that Amira and I together will answer all the questions that were sent. Just a reminder that you can always book a discovery call with me. I'm sure Amira has something else like that, and we'll include it in the email that we send you afterwards, because some of the questions are quite personal and quite detailed. And so I'll give you sort of the general overview, but it would always be a good idea to talk one-on-one about things if they apply directly to you. So some bonuses for attending live today. We will invite you to join our Flourish Females Facebook group, which is where we will post all of our webinars. We'll answer any of your questions. We'll post content that you won't find elsewhere. And also my goal is to create this community of women. So women that you can bounce questions off of when you need support, all of that. And so you'll be invited to join that. You will get a recording of the webinar. I realize this is 1 o'clock on a Monday, so things might come up and you might have to leave early, and that's okay. You don't need to message us in the chat. We get it. You'll get the recording afterwards so you can watch through. And then Amira will also send together some of her great resources for mindfulness in the email we send for you afterwards. So I'm going to quickly go over the research. So the research is very clear. And most of the research studies were done on patients going through fertility treatments. And this is because they're easier to test than maybe patients that are just trying to conceive on their own, because things are a bit more controlled when you're with a fertility clinic. But what we can do is we can apply this research to any couples trying to conceive. So when mindfulness is used as an intervention for fertility, there was a significant increase in mindfulness, in self-compassion, and in coping strategies. For any of us who have gone through going to a fertility clinic, like I remember the first time I went, I sat in the waiting room and nobody talked and nobody even made eye contact. Like, it was this very kind of weird, sterile environment. And so anything that we can do to develop self-compassion and coping strategies, I think is truly essential. Hopefully it's a different experience now. I was recently at a fertility clinic doing acupuncture for a patient, and it was like this wonderful bright room, and women were chatting, and it was really cool to see the change there. So also, the research shows a significant reduction in emotion regulation difficulties, as well as active and passive avoidance coping strategies. So again, really positive. And then also just general improvement in participants' well-being and a decrease in their psychological stress. As well, what was found was a decrease in depressive symptoms, internal and external shame, entrapment, and defeat. So all of these things are amazing. But what we can do is we can kind of assume that, yes, if you're going through a mindfulness program, it is likely that your outlook and your mood and your coping strategies, all of those things would improve. But something that was a bit surprising was there were higher pregnancy rates in the experimental group that received the mindfulness treatment during their fertility treatment. So I think that is a huge piece of information. So obviously, if someone's going through mindfulness, they're going to have better coping strategies. They're going to have a more regulated mood, but maybe what we didn't necessarily expect was to have a higher pregnancy rate in the group that were using those mindfulness tools. So that is really why I wanted Amira to come on today, and I wanted to share this with you, is because it can have such an impact on your journey. So it can make the journey more positive and more manageable, and as well a better outcome at the end.
Right.
So, yeah. Okay, so now we're going to get into it. I'm going to stop rambling on. So I have a bunch of questions for Mira, but I'm also just going to let you go. So maybe if we want to start off, you can just tell us, what is mindfulness?
Yeah. So, what I like to just explain is actually explain what the opposite of mindfulness is, because I think you can really identify that a lot better. And the opposite of mindfulness, the word I use to describe it, is autopilot, right? When you're just going from point A to point B, but you don't really know how you got there, and you're just go, go, go. And you're just there physically, but not mentally. And so an example I like to give is sometimes I'm multitasking and I'm doing many things at the same time. I'll be driving in my car and listening to music, and like the phone will be on, and I'll be petting the dog and having a snack. And I'm in so many places all at once, and I'm not mindful, right? I'm just all over the place, multitasking. And sometimes that's what we have to be like in order to be productive. But the problem with that state is when we're in that state, we're more open to like negative triggers, or, see, all of a sudden we may not feel like we're in such a great mood anymore, and we may not be able to identify it, or maybe we will. And that's autopilot. And so mindfulness is the opposite. It's reining ourselves in from doing all these things and just being present. So the definition is actually moment to moment awareness of our thoughts, our feelings, or anything that's happening around us. So imagine right now you're all listening to my voice and I'm talking, and you're sitting there in your chair, and this is all that you're doing. But you also have like other little voices in the back that may be, asking you or telling you what you're going to do after, or maybe judging your experience. And that's normal. That's like the monkey mind. So mindfulness is letting go of our thoughts and just bringing ourselves to the present. And a big part of mindfulness is acceptance. So accepting whatever's happening in the moment, whether it's an experience or a thought. I'm not saying that you're going to like it or that it's going to make you happy, but just bringing acceptance to it. And I think this is where the research comes in, because the more accepting and open we can be with our situation, I think the more open our body is, right? So when we're dealing with something that's difficult, it's like our natural inclination to contract and feel frightened, and maybe we try to push it away or avoid. And so instead of that, we're bringing ourselves into the experience, moment to moment awareness. I'm just going to accept what's happening. So mindfulness can be like an anchor. It's anchoring you, just like like a ship. It's for the night, it's going to anchor itself and just stay there. And so a way I like to describe it as an anchor is, and it's very simple, and it's something that you can use today, many times today or tomorrow. It's called the ABC of mindfulness. So A is for acceptance, just like I said. So whatever I'm experiencing, good or bad, I'm just going to accept. Whatever I'm thinking, I'm going to accept. I'm going to accept this pandemic. I don't have any control over it. And after we've accepted, we've moved to acceptance. B is for breath. Now I'm going to move from my mind and my busy thoughts to my breath. And you can take a deep breath. And C is just to stay centered, just for a moment, just to stay centered there. You've moved away and now you've brought yourself to the present moment. And that's mindfulness. That's mindfulness, using it like an anchor. But then imagine doing that. Imagine focusing on one thing for a period of time, letting everything else go, and all you're focusing on is one thing, right? You're still listening to my voice, but I bet you're not fully present listening to my voice. So oftentimes we associate mindfulness with the breath, right? And we think of like a yogi sitting on a yoga mat, closing their eyes. But that's not necessarily what it needs to be. It can be bringing it into your life with the things that you're already doing. So for example, in the morning, if you have a cup of tea or a cup of coffee, that could be your focus. So just focusing it on the experience, like tapping into your senses, the smell of the tea, the hotness on holding the cup, as it reaches your lips, and, the intention to swallow. Any thoughts you have, you're just going to let go, and you're just focusing on the experience of the tea. That's all that matters for the next 10 minutes. So in the group that I run, the Mind Body Fertility group, we have raisins. So I'll bring raisins for everyone, and it's a very traditional meditation, and each person takes one raisin and pretends that that's the most important thing they've ever seen. And that's their focus. Now, can you imagine how silly that is? And people are like, this is ridiculous. What is she making us do? I hate raisins. And those are all judgments, and those are all just thoughts. And that's just all background, right? And that's what you need to let go of to bring yourself fully to be with the raisin. So mindfulness is really practicing being present, and it has a spillover effect. So the more we practice it, the stronger it grows. And then it's not just about being present, it's how are we going to be present with ourselves? Because oftentimes we're very critical and very harsh and very demanding and very judgmental. So we want to be loving and compassionate, which is a whole other slant. So it's kind of just a way of being. It's a way of relating to the world, to your struggles, and to yourself. And it's a little bit better, and it's a lot more gentler, if that's even a word.
That's amazing. I know a lot of women, when they're going through fertility treatments, or even just trying to conceive on their own, that it's almost like you want to escape from it. So you want a distraction. How would those people apply mindfulness, or how do you apply it specifically to trying to conceive?
So exactly. So oftentimes we want to have it is a distraction. Sometimes we distract ourselves with things that aren't very healthy for our coping, and I call it maladaptive coping. And that's when we go online and we look at other women's stories, or we do like our own research, or it's like a rabbit hole. And so on some level, we feel like we're being productive and that we're getting more information and that we're informing ourselves. But I don't think that's helpful. I think to leave that aside and try to escape with mind body and like allowing yourself a reprieve. You don't always need to be thinking about this. You don't always need to be problem solving this. Sometimes there isn't anything to solve, right? Just allowing yourself to be, which is really hard, right? It's not easy. And so it takes practice, and you can just start for 5 minutes a day for the first week. And you can put on a little timer or just on your own and do something present for 5 minutes.
Amazing. That's a really great suggestion for places to start. Do you have other techniques other than mindfulness that you encourage women to use when they're trying to conceive?
Yeah, I mean, mindfulness is, it's very broad, but and it's very creative. And there's like visualizations where you can visualize what it is that you want. Or there's other exercises such as cognitive restructuring, where instead of letting our thoughts go, we actually look at what they are. What is our thoughts, and what validity do they have? And sometimes there is validity, and we try to break them down so we can make them into something that serves us better.
Kind of like
So,
reframing.
pardon?
Kind of like reframing.
Yeah, like a restructuring, exactly. Like broadening our perspective. It's not fixed,
Right.
right? Although there's a very strong negative bias.
Mm-hmm.
But we have the power to change that. It just takes a little bit more effort.
Right. Your mind is a muscle. Somebody told me that once. Like we do all this work on our bodies, like exercising and like training our bodies, but yeah, you have to put the work in for sure for mindfulness and to work with your mind as well.
Yeah, we have over 50,000 thoughts a day,
That's wild.
and like many of them are just repetitive and aren't true, and we don't need to attend to all of them.
Mm-hmm. They're not serving us.
Right.
Is there anything else you want to share about mindfulness before you lead us in an exercise?
I think it's just, when I first started practicing, which was over like 15 years ago, I always felt like I was doing it wrong, right? Because you get so distracted in your thoughts, and you get so, you're pulled away again and again. And that's normal. That's actually what mindfulness is. It's just the bringing back, noticing what's taking you away, seeing if you do notice, if you can label it, letting it go, and bringing yourself back. Sometimes we don't always know what it is that's taking us away. But if we can know, and maybe it's the fertility treatment, maybe it's work, maybe it's the to-do list, maybe it's like an itch or a pain in the body, just notice it, label it, and bring yourself back. Creating that space between you and that thought.
That's awesome. That's really great advice.
Yeah. So I have a meditation. I took, when I did my hypnotherapy certification, I took a course. It's called the Fertile Body Method. And it's got a number of different scripts and exercises that are focused on women going through fertility treatment at all different stages. So there's one that's one of my favorites, and it's a very creative meditation. So I'm going to start, and all I want you guys to do is to sit back, to just listen, to let go of your thoughts, to focus on my voice. And if you notice yourself getting distracted, that's okay. Just notice, label, and bring yourself back. This is a bit easier because I'm guiding you. So you can close your eyes and just allow yourself to let go, and just connecting to your breath, allowing the air to just go in your nostrils. If you'd like, you can put your hand on your belly. And as you breathe in, you can feel your belly rise. And as you exhale, just notice your belly fall. I just want you to become aware that your body is made up of different parts. And each part of your body has its own unique function, its own specialty. And you can also become aware that every part of your body is connected to its own set of memories, to its own history. For example, only your fingers can remember what it feels like to be in the warm, soapy water. And each finger has its own unique individual memory of each of those experiences. Every part of your body holds within it a complete set of memories, sensations, experiences, and knowledge. And if you pay attention, you will begin to notice that you have different relationships with these different parts of your body. For example, the way you feel about your feet is very different to the way you feel about your ears. With each and every part of your body, you have a unique relationship. But right now, at this time in your life, your attention is being called down to the organs of your reproductive system, to that inner part down there below your belly, your ovaries, your womb. And each part has its own memories and experiences. And maybe you have given some attention before, maybe a lot of attention, or maybe none. Perhaps you've noticed how hard this part of your body has been working for you. What I want you to do now is to just become aware of your reproductive system. Just for a moment, for this moment, just pay special attention to your womb. When you think about this part of your body, how does it feel to you? Does it feel big or small, or long or wide, dark or light, spacious or cramped, hard or soft? Just notice the relationship you have. Some people find that they need to give their womb more nurturing, more love. Some people find that they need to talk to it, to pay it more attention. And like all relationships, you will find that the more attention you give this part of your body, the better the relationship becomes. Like all relationships, the more you give it, the better it becomes. And so you can begin to find ways to pay attention to this part of your body more and more every day by noticing it, by thinking about it, by trusting it, by feeling it more and loving it more. And what you are doing is creating a nurturing, loving, safe environment conducive to life. You are creating a healthy, fertile state. Now, when you're ready, I'm going to ask that you wiggle your toes. You can open your eyes and come back to the virtual room. That was a little bit more of a creative one, and it was just having you go a little bit deeper inside.
That was awesome. Thank you so much. I'm feeling so relaxed. That was so great.
Yeah.
Okay. Amazing. Sorry, I'm going to go back to just sharing the screen here for a sec. Awesome. So that was a really cool. So that was a guided meditation.
That was more of a guided meditation. I think it would be just a little boring to just focus on our breath here, but I'm sure you listen to my voice and you were able to like connect to like what I was talking about, but I'm sure you also noticed your mind wander, right?
Mhm.
So sometimes it's easier to do a guided meditation as opposed to sitting there for 5 minutes focusing on your breath.
Totally.
So like we went inward, and I just really like that one because I find most women don't think of their reproductive organs that way, right? And if anything, during this struggle, they have a negative view of it.
Hmm. Yeah, someone just messaged through the chat saying that brought up a lot of interesting things for them. So yeah, definitely. And for me as well too. Yeah. Yeah, so
I
cool.
shortened it because it does go a bit longer in spots, but yeah, this book is so wonderful.
Amazing. Great.
Yeah.
Okay, I want to make sure we get to the questions. So I'm just going to go the three questions. These are from the Instagram poll, but definitely if you have other questions, feel free just to put them in the chat now. I'm going to go over the top three because they're not really to do with mindfulness, and then Amira will do the bottom three. So someone was asking me about fitness and fertility. So is it helpful? Is it unhelpful? What are some things to steer clear of? So definitely, like, it is important to be active for sure, but there are a couple things you want to think about when it comes to fitness and fertility. So one is weight. Women need a certain amount of body fat first of all to get their periods and to cycle. And for most women, it can depend on build and a lot of other things, but for most women, this is usually a minimum of 20% body fat to be able to attain pregnancy, and somewhere between 20 and 31% body fat. Being overweight can also impact fertility, so you want to keep that in mind as well too. A tool that some people will use for fertility is looking at your BMI. So it's basically it's looking at your height and your weight, and it's a calculation. You can easily calculate your BMI online if you just go BMI calculator. And it is a tool we can use. You do want to keep in mind that if you are very fit and you have a lot of muscle, your BMI is going to be falsely elevated. So your BMI would most likely be much lower because it doesn't take into account the fat versus lean tissue. But generally a BMI somewhere between 20 and 25 is optimal for pregnancy. But again, you do need to keep in mind that you have that body fat component. And so with exercise, low to moderate exercise can be beneficial because it increases blood flow to the pelvis. And it can also be a great stress reliever. I know I have a lot of patients that were like marathon runners, and we had to kind of modify their exercise when they were trying to get pregnant, because I have a lot of elite athlete patients, and they would not get their period, especially when they're in heavy training. And it's just because their body fat would drop so low. So low to moderate exercise is beneficial, but if the exercise is too high, if the intensity of exercise or the amount of exercise is too high, body fat will be too low. And body fat is where estrogen and other hormones are stored. And so if those hormones are too low, you won't be able to get a period. And you also, it doesn't always go hand in hand, but usually when there's no period, there's frequently no ovulation as well too. So everyone is different in terms of what the ideal amount of exercise is. Usually for most women, their sweet spot is somewhere between 30 minutes 3 times a week and a max of 60 minutes 5 to 6 days a week. So if you're doing way more than that, you might want to scale it back. If you're not doing anything, maybe think about even just like walking right now, or doing like one of the virtual yoga classes or something like that. But low to moderate exercise is beneficial. Intense exercise is not. So that's a very long answer to that question, sorry. Is ashwagandha safe for pregnancy? Ashwagandha is not safe for pregnancy. So it's considered a category 2B herb, which means that it is not to be taken during pregnancy. And in the case of ashwagandha, it can be what's called a uterine stimulant, which means it can promote going into labor too early. And so we don't recommend it's taken during pregnancy. So what I recommend is whenever my patients are doing anything in their regular life that's not safe for pregnancy, is once you ovulate that month, then stop taking it. So for example, if you ovulate on day 14 of your cycle, which is just the average, you don't have to be ovulating then, but you might take it from day 1 until day 14, and then you don't take it in the second half of your cycle when you might be pregnant. But that's a great question. There's a lot of herbs that aren't safe for pregnancy. So feel free to message if you have other specific questions. And what prenatal do I recommend? Oh, look at your puppy. So sweet. Oh my goodness, like a teddy bear. I have no affiliation with any brands. There are some prenatals that I really like because I think they're a great price point, and really good ingredients. But what's most important about your prenatal, especially when you're taking it before you're pregnant, is that it has a methylated form of folic acid in it. So look at the ingredients of your prenatal. Does it say methylfolate or methyl tetrahydrofolate or MTHFR? If it just says folic acid, it is not a good prenatal. You want it to be methylated. And it is a big pet peeve of mine because the two big ones, which I won't bash openly, but the ones that are covered under everyone's drug plan and are so accessible for a lot of patients are not, they do not have the active form of folic acid in there. And so even if you don't take a prenatal before you're pregnant, do take a milligram or 1,000 micrograms of a methylated form of folic acid. That's most important for the 3 months before you get pregnant. Okay, those are my questions. I'm gonna let Amira go on the bottom one. So first question is, how frequently should one be practicing mindfulness?
Yeah, so I think, starting at just 5 minutes a day for the first week, and then increasing it maybe to 10 minutes a day, and ideally 20 minutes a day should be a good amount, and not necessarily sitting there focusing on your breath or your tea for 20 minutes, but you can actually even break that up, right? So doing one thing for 10 minutes, like a mindful walk. Again, you're focusing on just the walk and your body moving, and you're tapping into your senses, but picking things that you can do mindfully. And I would say, going slowly up to 20 minutes a day, every day. And that should be a good amount for you to get that spillover effect and start to feel different in a week. After you get the 20 minutes once a day and then do that for a week, you can't not feel better.
Amazing. So start at 5 minutes, work up to 20.
Yeah.
Amazing. Okay, next question is, I'm really struggling shutting off my brain. I feel like my meditation always ends up either in a nap or in an anxiety spiral. Any advice?
Yeah, so that's very common. Again, like tiredness and anxiety, these are other like ways the mind is trying to take you out of your presence, right? So just to notice, like when you start to feel anxious, and notice and label the thoughts that are coming up. And again, you're feeling really tired, I'm feeling really sleepy, and you don't want to go to sleep when you're being mindful. There's different techniques, like with hypnosis, that you can go to sleep, it doesn't matter. But when you're trying to be present, then you don't want to fall off to sleep. So it, depending on what type of person you are, I mean, there's some people that are very, type A, go, 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 and it's hard for them to shut down and calm down. So I think listening to guided meditation could be easier than doing it on your own at the beginning.
Awesome. So starting with like a short guided meditation.
Yeah, but that's very normal, and to have that experience.
Mm-hmm. I treat a lot of really busy and powerful and amazing women in my practice. And I would say that's like a consistent across the board thing when we talk about like stress or coping mechanisms, that they're like, no, I do HIIT workouts. I don't do any yoga. I need that, like, it's intense stimulation.
Right. But it's,
yeah. And when we talk
you need to give your body, your mind the break. Like,
exactly.
You can just have that reprieve. You don't always need to be thinking, and it's a very calming effect on your system.
Yeah. Amira, you have such just a calming, I feel like talk, I'm just like, oh, so great. Then the last question is, does a mindfulness practice have a beneficial effect on male fertility too?
Interesting question. I don't know like how it would be direct. Like, I always feel there's always a beneficial effect. For me, like, I don't like to stress so much, like you're going to do this and then get pregnant.
Yeah.
It's interesting because I run a program for 6 weeks, the Mind Body Fertility Group, and some women will go through treatment during the program, and then we'll see the outcome at the end. And so sometimes it's not always positive, but the way it's received is a lot better because they just feel more balanced.
Mm-hmm.
So I don't know how it can't harm the fertility,
Mm-hmm.
and it will just put him in a better mood altogether and feel more calm.
Mm-hmm.
But I don't actually know the direct relationship. That would be interesting to look
Really?
at.
I know there is a connection between cortisol and sperm maturation, because I remember looking at a study about that one. So maybe I'll look into that and I'll post about it as well
Right.
too. But I totally agree. I think that just being more present and being more mindful, your body is going to be out of that fight or flight stressed mode, and your body's just going to function better.
Right. Yeah.
Amazing. Okay, I'm just going to go. Any other questions? So I don't see, I'm just going to stop the screen share for 1 second just so I can take a look at the Q&A. But if you do have any other questions, please just pop them in the chat. Give me 1 second here. Hopefully you're not looking at my hideous background of a million windows open at once. Here we go, Q&A. Okay, yeah, I think we've covered all of this stuff, which is so great. Okay, good. So go back to this here. Oops. Sorry, close the Q&A so I can see. Okay, perfect. So these are just some references. So all the studies that I talked about at the beginning, all the references are all there. And just another note that feel free, I'm gonna send out an email shortly with Amira's awesome resources. There'll be a link in there if you wanted to book a discovery call, which we can chat, and I'll talk to Amira about how she does sees new patients and how that process works for her as well too. But if you are going through your own fertility journey, definitely I'd encourage you to reach out. The discovery call with me is completely free, and it's basically just like a 15-minute amount of time for you to ask any questions, and we can talk about all of that. So thank you so much, Amira, for being here.
Thank you so much
today.
for having me. It was so fun to do this with you.
Yeah, it was so fun.
Congratulations.
Thank you.
I'm so excited.
Yes, I know. It's just an exciting time. Springtime.
Yeah.
Time.
I love that image too behind the flourish.
Yeah, my another one of my patients actually referred me to this amazing woman who's a designer, and she just does her own thing. Her name's Kelsey Hannon. And I originally, when I told her, I was like, oh, I want it really clean and like black and white. And then she was like, okay. And she's like, you know, that flourish means like life and color and vibrancy. And the opposite of flourish would be death, which is kind of what you're describing in terms of your brand. Like, you're right. So now we ended up with this like mad amount of color everywhere, which I love. So
yeah, it's gorgeous.
Thank you. Awesome. Well, thank you so much, everyone, for being here. And if you couldn't be here live, we'll send out this recording, and feel free to message or email me if you've got any questions. All right.
Great.
Bye, guys.
Bye.
Have the rest of your Monday. Thanks again, Amira.
Take care.
Thank you.